Afternoon.
Good afternoon.
Assalamualaikum warahmatullahi wabarakatuh. Konnichiwa for friend from Japan and also salam sejahtera untuk teman-teman Malaysia. If there is some people from India, Om Swastiastu, and also Namo Buddhaya. So we have many greetings for Indonesia because we have many ethnicity, and if we reflect it on our areas, we have so many situations on area geographically. So people always say that Indonesia has been blessing with the many of disasters, but we have the same thing. Pandemic COVID-19 is one of the global quote-unquote humanitarian disaster. So thank you for joining with this event. I think this event already have been conducting 3 years from 2020 and online base because we have already activity before that one. So this is the last session of 2021 and 2022.
Recording in progress.
Of the 3 series. So I hope that we can have a good session today. And before we started with 3 lecturers, I don't know exactly whether Prof. Andi have been here, but of course I will asking Pak Made Andi Arsana. Pak Made have been here?
Yeah, I think so.
Yes.
Because in this rundown, remark from Yudhis Gajah Mada, Bu Pipit,
Hello,
can
Pak.
I ask you for Pak Andi?
Sure. Pak Eka Putra, can you hear me? Check.
Is my voice is have been here?
Mbak Ade, can you hear my voice?
Yes, loud and clear, Pak Andi, Pak Ika. Yes, we can hear you.
Okay, good.
Let me check if there is Pak Andi or
I think
Pak-
Pak Eka cannot really hear us.
Yeah.
Pak
Eka Putra.
Andi Made.
Yes, I'm here, Pak. I think Pak Eka
Sorry, is
Putra.
my voice is here? It's heard?
Yeah.
Oh,
But maybe you cannot hear us.
there is some problem.
We can hear you, Pak Ika Putra.
Okay. Let me check my voice ya. Suara saya nggak kedengeran ya?
Kedengaran, Pak.
I think I texted already to Pak Eka because Pak Eka Putra apparently couldn't hear us, so it's no point for us to say anything.
Apakah suara saya terdengar, Bapak?
I'll just call him.
Let
I'll
me
just call.
check my test speaker. Ya,
Can you hear you, Pak?
sudah terdengar, Pak.
Siap.
I'm sorry. This is my. I think I have to test first, but I haven't do that. Okay, Pak Andi, silahkan.
All right. Thank you very much, Pak Eka Putra, for the introduction. I would like to also say hello to each and every one of you. Thank you very much for attending this meeting. It is a great honor for us to once again collaborate with our partners. We have been collaborating for quite some times now. I hope everybody can hear my voice. Can you?
Yeah.
Yes.
Okay, good. We have been collaborating for quite some times now, and this is the very first event that we have in 2022. I would like to thank once again everybody for your willingness and for your dedication to contribute to this meeting. And we really hope that this is not the last meeting or the last collaboration that we have. We are looking forward to having more collaboration in the future. And this time of the event, the topic is more on tourism. And we really hope that in this not very easy time of the year due to COVID-19, we might need to look at this matter from a different perspective. When physical mobility is not as easy as 2 years ago, I think we should innovate how we can see this area and how we can still benefit from the area. So I think the speaker that is coming to talk to us today will be able to enlighten us with that particular matter. And we really hope that out of that, we can have some more ideas for collaboration in the future. So I think that's probably a short remark from me because I really want to hear from the expert how we can study, how we can understand this matter more, and how we can collaborate more in the future. I think that's it. Thank you very much, Pak Eka Putra.
Terima kasih Pak Andi, and we will welcome 3 experts and speakers from 3 countries. And I think it will be interesting to hear as Pak Andi Made said. And the first speakers coming from Japan, Professor Ukamura Katsuhiko. Konnichiwa.
Yes,
Ukamura
konnichiwa.
Sensei.
Hi.
Hi.
Hi,
Yoroshiku
everyone.
onegaishimasu.
Thank you very much,
Yeah.
Chairman. Okay.
Okay, I will read short CV of Ukamura Sensei. Ukamura Sensei has been engaged in the management of ANA, or All Nippon Airways, that operate international flight for 38 years. He would like to utilize his experience in airline management planning and other experience to teach young students who will support Japan in the future. He especially teach tourism and aviation at university in the metropolitan area. As we know, airline transport, one of the most suffered business during the pandemic COVID-19. And I think this is a good experience to hear from the expert, Professor Ukamura. And Ukamura's presentation's title will be Changes in Tourism Due to COVID-19, Acceleration of Change and Transformation. Time is yours. Yoroshiku onegaishimasu.
Thank you. I share my agenda. Okay. Hello, everyone. My name is Katsuhiko Okamura, Professor, Faculty of Business Administration, Kansai University of International Studies. Now I talk about change in tourism due to COVID-19. As you know, COVID-19 has a tremendous impact, not only on domestic tourism, but also globalization, such as international aviation and international tourism. In the last 2 years, new drug development, such as vaccine, various infection prevention measures, relief measures for businesses, measures to promote tourism demand, etc., have been implemented on a large scale in many countries and have had a certain effect. Due to the decrease in overseas business trip, anxiety about infection during travel, immigration bans and restrictions, overseas travel will slow down until COVID-19 weakens and people's psychological resistance weakens. There is an alternative shift to neighborhood travel, as we say, microtourism, and a shift to digital and virtual tourism or other products and services. I think that these movements of changing tourism had sprouted before COVID-19, and COVID-19 accelerated the change and transformation on tourism. Today, I would like to talk about this. My English pronunciation is not good, so there are some parts you can't hear well. I will beg your pardon in advance. This is today's topics. First, talking about tourism in Japan up to COVID-19. Second, with impact of COVID-19 on Japan's tourism. Third, with widespread countermeasures. And fourth, with changes in Japan's tourism. Finally, I said the conclusion. This is introduction. Japanese government has set a policy of becoming a tourist-oriented country since 2003. And government established the Japan Tourism Agency in 2008. The Japan Tourism Agency has refined Japan tourism resources, enhanced its acceptance system, and expanded its PR in overseas. During the period, the Japanese economy was stable and domestic travel by Japanese people remained firm. And the number of tourists from overseas increased at an accelerating rate due to effects of PR in overseas. The situation changed dramatically in January 2020 due to the worldwide spread of COVID-19 infection. The number of tourists has significantly decreased. In particular, the number of tourists from overseas has decreased as much as none. First, we will examine the impact of COVID-19 on international tourism. This is a graph of change in number of international tourists and changes in the world real GDP. COVID-19 drastically reduced the number of international tourists from 1.466 billion in calendar year 2019 to 394 million in calendar year 2020, down nearly a quarter. It may be said that the situation is as if globalism is over. The loss of the international travel market in calendar year 2020 will be 1.3 trillion US dollar, 11 times the 2009 during the Lehman shock. Unlike the time of the Lehman shock, travel, tourism, and the transportation industry have been greatly affected at this time. The International Civil Aviation Organization, ICAO, announced that the number of air passengers in the world in 2020 decreased by 60% from the previous year to 1.8 billion due to the movement restrictions caused by COVID-19. In 2019, there were 4.5 billion people flew world. International Air Transport Association, IATA, expects 2021 to be half the number of passengers in calendar year 2019, as the central part of the graph is heavily dented. IATA projects a scenario in which global air passenger transportation revenues will recover to 57% of 2019 calendar year level in 2021, 79% of 2019 level in 2022. Cargo revenue is increasing, but the unit price of cargo is lower than that of passengers. So the decrease in passenger revenue can't be offset. The number of passengers in 2030 calendar year is expected to increase to 5.6 billion, but it is expected to decrease by 7% from the forecast before COVID-19. The increase in tourism from overseas to Japan, which is Japan Tourism Agency, has been making efforts for many years, has also decreased sharply due to the influence of COVID-19. The number of Japanese overseas travelers is also decreasing sharply. It's like a vertical descent. COVID-19 has a great influence on domestic travel in Japan. The total number of Japanese domestic travelers have dropped to about half of the previous number of both overnight trips and day trips. The number of domestic trips and overnight stays per traveler in calendar year 2020 is also half of the previous years. The Japanese government has taken travel support measures to stimulate the reduced demand for domestic travel. Please look at graph, changes in Japanese domestic travel consumption. Travel increases due to support measures from the summer of 2020, but support measures were interrupted due to the re-expansion of COVID-19 infection. And travel also decreased. In addition, free vaccination of COVID-19 vaccine to the people started from the beginning of 2021, and 78% of Japanese people have been vaccinated twice up to now. In addition, the third vaccination began in December 2021. Due to the vaccine effect in 2021, Japan's domestic overnight trips and day trips were on a recovery trend. But from January 2022, the infection of Omicron strains spread rapidly, which may have a negative impact on travel. COVID-19 have significantly reduced the number of tourists. So many hotels and inn companies have reduced employment and are helped by government loans and subsidies. In the hotel and inn industry, there are many micro enterprises. The number of employees has decreased by 8%, and the number of non-regular employees has almost doubled, decreasing by 15%. The decline in travel demand has also created a large deficit for Japanese airlines. ANA posted deficit of 400 billion Japanese yen in fiscal year 2020. It is expected to have a deficit of 140 billion Japanese yen in fiscal year 2021. In addition, JAL posted a deficit of 266 billion Japanese yen in fiscal year 2020 and deficit of 156 billion Japanese yen in fiscal year 2021. The reduction in passenger flights will reduce the space for carrying cargo because many air cargo will be transported under the floor of passenger planes. So it reduces the cargo revenue. Next, we will examine a wide range of countermeasures such as prevention of infection spread, government support, measures of business operator. The first is infection prevention measures. As a measure against Omicron strains, foreigners have been banned from entering Japan since December last year, unless there are special circumstances. When Japanese return to Japan, if the person is positive, he will be hospitalized, and if negative, he will be quarantined or voluntary quarantined for several days. Next is government support to tourism-related business. The government has set up interest-free and unsecured loan of up to 600 million Japanese yen for businesses whose income has declined due to COVID-19. More than 90% of hotels and inns use this. The government provided employment adjustment subsidies to employers who maintain employment through COVID-19, loans and capital increases to major and mid-sized companies by government-affiliated bank, airport charges and aircraft fuel tax reduction and exemption to domestic airlines. To cover these huge costs, the government has set up a huge supplementary budget of 72.9 trillion Japanese yen in fiscal year 2020 and 35.4 trillion Japanese yen in fiscal year 2021. And most of fiscal resources are government bond. Next is government support to stimulate travel demand. The government subsidized to cover 35% of domestic travel expenses and 15 souvenir expenses from January to November 2020, named Go to Travel to Japanese. It was used by a total of 52.6 million people and travel demand expanded, but it was cancelled because the infection spread again. The policy is being considered for resumption in 2022 from the evaluation of sending money to rural areas. Of course, businesses are also taking countermeasures. Reduction of investment and non-urgent cost. Stop hiring new employees, promoting employees' retirement, send employees to another company while remaining in the companies. Reduction of unprofitable department, branch integration and closure, sightseeing flight, in-flight meal sales, etc. But unfortunately, these are just drops in the bucket. Next is how Japan's travel is changing under the COVID-19 situation. First, business travel will decrease. Even if COVID-19 converges, some business trips will be replaced by video meetings, such as Zoom, like this, especially for international business trips. Companies realize that it could cut costs, and employees realize that these could work more efficiently. It will take several years to reach the volume of overseas businesses trips before COVID-19, and the use of excellent class will be reduced by cost reduction. Declining business travelers and refrain from using luxury class will have a negative impact on airlines and hotel industry because average business passengers price were higher than that of private tourists. In anticipation of this trend, ANA and JAL are focusing on expanding the network of LCC low-cost carrier subsidiaries. On the other hand, airlines are in a difficult situation because they must promote the introducing of new fuel-efficient passenger aircraft to reduce CO2 emission. The trip itself is changing. The first movement is microtourism. It is said to be effective in preventing the spread of infection because it can reduce contact with people due to movement. Tourists to nearby area is increasing in many countries. In Japan, the number of people traveling nearby, such as within the prefecture and regional blocks, is increasing. The proportion of overnight and individual travel in microtourism is also increasing. As microtourism increases, tourism industries must consider how to increase the average customer price and repeat rate. The second movement is workation. Workation is a travel style that combines online business and vacation. It is a work style that started mainly in the United States in the 2000s. It became widespread as it became possible to use the internet on mobile. In the past, it was a style of extending the stay in leisure time at the destination of business trip. Now there is a vacation priority type of vacation. And there are types of work-oriented vacation. Advantages for employees are refreshing effect, increased paid leave acquisition, improvement of business efficiency, and get new encounters and ideas. For companies controlling the outflow of human resources and others, and for region increasing in the exchange population, promotion of regional economy. Many regions are embarking on attracting vacation, but vacation has disadvantage for company, such as difficulty of work management and others. Next is outdoor-oriented leisure. Outdoor-oriented tourism is gaining popular in Japan. with the increase in COVID-19 infection in urban area, the needs for outdoor-oriented leisure in suburbs and rural area is increasing. There is an increasing need for glamping, a higher priced camp that not only a tent, not require a tent, and is fully equipped with food and water sports. Stay type tourism, staying in one area and thoroughly experiences the culture and lifestyle of the area. And decentralized travel during weak demand periods are also attracting attention. Before COVID-19, personal travel in which individual plan trips for their own hobbies and interests, during without the intervention of a travel agency, is expanding in Japan, and I think COVID-19 is accelerating. Since personal travel requires ease of travel to the destination, it is convenient to have a service like mass. In addition to transport, some have added such reservation and payment function for seeing, eating, and playing. Online tour. The last item is online tour. Online tours are increasing. As a search for new trips, JTB Research Institute pressed a survey that about 25% of inexperienced people want to do it. The advantage of online tour are compensation of income for travel cancellation. Finally, I would like to make a conclusion. The first is that COVID-19 have had a huge impact on international aviation and tourism, as well as domestic restaurant business and tourism. Second is part of business trip will be replaced by remote conference such as Zoom, and leisure tourism will continue to grow as the economy expands after COVID-19. There is a shift to neighborhood travel, microtourism, vacation, outdoor-oriented leisure, and online tour. Third is that this movement of change in tourism had sprouted before COVID-19, and it is thought that COVID-19 accelerated the change and transformation of tourism. The last, I think these changes in tourism are not temporary phenomena. I conclude my speech in hope that COVID-19 will converge as soon as possible around the world. Thank you for your kind attention to my poor pronunciation. Thank you.
Thank you, Professor Okamura. And I think have been already concluded by Okamura Sensei, but at least there are three keywords. No matter how attractive your place as a destination before COVID-19, but after COVID-19, there is a decrease of travel demands and will be change all the business in related area of the tourism. And then there is some also behavior that change transform into thing that there should be a new ideas on like micro tourism, LCC development, also workation, or we know that outdoor leisure have been already developed in many countries. So Now there's a question and answer, and I welcome everybody to raise questions or confirmations on whatever, so that this interesting lecture can be more valuable to us. So, okay, you can raise hand or just directly open your mic. Maybe students or sensei also is okay. If not, then I will ask you, Professor Komara Sensei. There is one of the very interesting data which is connected to your decrease of passengers of the travel, but in the same time, you have increase of cargo courier atau cargo transport. But you said that it's not really significant in the value. How you can explain more on that one? Because subsidiary maybe can be going into cargo to passengers, and this, is it possible for that?
Okay. The unit price of cargo is 110.
Okay.
1.10 of the passenger unit price of passengers.
Mm-hmm.
Very cheap.
Mm-hmm.
Very cheap. So if airline transport cargo, the revenue is only one-tenth of passengers, and many cargo are transported under the passenger planes lower cabin. So if airline cancels the passenger plane, many cargo will be canceled.
Okay. Do you have any ideas if you're comparing with the price of the cargoes or logistic transport in airlines, if we're comparing with non-airlines transport? Because as we know that, I agree with you, that so many logistic transportation service has been developed so much. But of course, if you looking at from airplane price will be not significant. But how about the other, if you know about, for example, land transportation for the logistic or cargo? Could you compare with the significantly increase of the cargo transport between the airlines mode and also other than airline mode, for example, truck or takupin, whatever?
You mentioned about the unit price of the land transport and air transport. Okay. Yes. The unit price of the air cargo is very expensive. And truck cost is very cheap. Yeah. And the ship cost is more cheap.
Oh, really?
Yeah.
Okay.
But I don't know exactly the unit cost.
Okay. Thank you, Okamura Sensei. Is there any question from students or?
Can I ask some question to Professor Okamura also?
Sure.
Thank you, Pak Ika Putra, and hi, Okamura Sensei. I just want to ask that since Japan is a well-known kind of cultural tourism country. And as far as I know, until today, Japan is still close to international tourism. I mean, tourists to come to Japan. Is it affect or be affecting big time that since the border is still closed, so the income will be lower than usual? And can you tell us maybe, is there any future plan for the international tourists who want to visit Japan anytime soon? Thank you very much.
Thank you. But I don't know exactly. Maybe God knows. God knows.
Sure.
I hear that the Omicron is very strongly, and the changing strains will be seen. So it may be long until spring.
I see.
Thank you.
Thank you very much.
Thank you, Sepitri-san and Okamura Sensei. We still have time if there is still have questions on especially tourism, because so many concepts and have been already implemented on microtourism. There is a workcation, and we know in Indonesia we have staycations. So very interesting to hear from Japan, because there is regional delineation of the destinations have been developed, and we know that we have already phenomenon on that. Okay, if there's no, we still have time later on. Thank you, Okamura Sensei, and we have been listening for interesting lecture. For the next speakers, let me check. Okay, the second expert or speaker is Dr. Peter Gan Kim Soon. Selamat sore, Dr. Peter.
Hi.
Dr. Peter actually public health physician with the Minister of Health Malaysia, and he received his medical degree from Manipal University and holds a Doctor of Public Health from the University of Malaya. He also received his Master of Art in Medical Ethics and Law from King's College London and Master Public Health from the University of Malaya. Dr. Peter is an active medical volunteer with Mercy's Malaysia and Hope Worldwide Malaysia. I think it's all is connected to disaster relief, I believe. He is an executive council board of Mercy Malaysia, who support the coordination and strategic direction in medical and humanitarian relief of the organization and advocates the Sustainable Development Goals, or SDGs, especially for health. Dr. Peter's title of the presentation is What the COVID-19 Pandemic Teach Us About the Future of Public Health. Dr. Peter, time is yours.
Thank you so much. So thank you for this opportunity. So I hope that my presentation will not be too technical for you. So my topic for today is actually what's the COVID-19 pandemic going to teach us about the future of public health. So just a short introduction of COVID-19. So everyone knows that the pandemic is caused by SARS-CoV-2. So it didn't actually affect just tourism, it affected the healthcare dramatically. So as we move on and we want to restore our services, we need to be prepared for the future, because this will not be the last pandemic that we were going to be facing. So we would like to be in the know and also consider other environmental, social, and economic factors that are connected to our health. So we need to renew coordinated action across the healthcare system, as well as beyond that. So I'm going to talk about 4 focus areas here, mainly the workforce, digital health, equity, as well as partnership. So I'm sure a lot of you do not have a background in public health, so I'll just briefly tell you what public health is. So public health works in stealth, so no one knows what public health is, but it is the foundation of the healthcare system. So if you know about public health, means that the public health system actually screwed up. So that's how you know about it. So these are the things that public health actually relates to. So it's mostly non-hospital based services. So these are the people that are in public health, but in public health itself, we need a lot more other people from non-medical backgrounds as well, which is on the left side. So we need a multidisciplinary and multi-sector involvement to make public health a reality that is safe and it increases productivity for the population. So why is public health important? Why do we need to incorporate public health into our healthcare system, into the community to know about it? Because if you look at this diagram, we usually just focus on the clinical side of it. So no one talks about the environment, the policy, even tourism itself actually have an impact on public health. So the society understanding of public health has to improve so that their health and their health-seeking behavior improves as well. So these are the skill sets of a public health practitioner. So there are strategic skills as well as specialized skills. So these are the things that I hope that in the future, after this pandemic, a lot of countries will actually look into this, because public health is the cornerstone of healthcare, and we need to have everyone trained in it so that people's health can improve and productivity improve as well. So this is called the T complementing specialized and strategic skills. So currently, this is the system that we have, which is an inverted pyramid. So because the pandemic has brought out public health and its importance, so I think now a lot of governments are looking at how to actually improve and increase funding for public health. If I'm not mistaken, a majority of the countries around the world only spend about 20 to 30% of their budget on healthcare, on public health, where almost 70% of it is in tertiary care, which is in the hospital. Secondary care is also hospital care as well. So if you look at it, so majority of the spending is here actually, while preventive and public health care is only 20 to 30%. In Malaysia itself, we haven't actually reached 20%. It's about 15 only. Now moving on to more general stuff about healthcare. So healthcare workers actually, mortality actually was pretty high during the pandemic, and I don't think a lot of people were aware of it. So these are the number of healthcare workers that actually died from COVID-19. So WHO actually estimated about 115,000 healthcare workers died from COVID-19 from the 1.5 years of the pandemic. So if you look at this study that was conducted in the US and the UK, it shows that the number of healthcare workers that were tested positive for COVID-19 is much more compared to the general population. It shows that we are more likely to be infected with COVID-19 because we are more exposed and we are more at high risk because we are always treating patients with COVID-19 or having interactions with COVID-19 patients. So if you could see here, that is one of the reasons why healthcare workers are at risk, and more attention needs to be given to healthcare workers in regards to this. And one thing about it is the mental health of healthcare workers. If you could see in this diagram, the anxiety, the depression, and insomnia has actually elevated slightly, not significantly, but you could see a huge difference pre-pandemic and post-pandemic. So although healthcare workers' jobs are pretty stressful at times, but because of the pandemic itself, it has actually forced us to work to our bones, actually, frankly speaking. So these are the issues that a lot of people do not actually look into, which is mental health. I think that is one of the things that I hope this pandemic would change the mindset of people and actually put mental health to the forefront. Okay, so I'll just like to give some examples of what we can do to improve the workforce of the healthcare workers. So in terms of recruitment and retention, the support as well as education as well. So a lot of, for example, in Malaysia, we have issues of career progressions because we have contract doctors who do not have the opportunity to pursue further studies to specialize. So this COVID-19 pandemic actually has brought this issue up many times. So it became an issue, and it had to use the cabinet ministers to resolve this. And finally, contract doctors now have the opportunity to actually pursue their higher education to specializing into different fields, although they are not permanent staff with the Ministry of Health. Okay, one thing that I was mentioning earlier is mental health, the most important of all. So sometimes what we do here is we rotate the healthcare worker from a high-risk job description to a low-risk. So they go on rotation basis so that they don't get burnt out. So we also provide mental health services to doctors. If they require, for example, PFA, psychological first aid, they can actually call hotlines that are available. And we always encourage them and advise them to communicate with their loved ones regularly. And the most important thing is healthy lifestyle. Well, it's not just for doctors, but also for the general public as well. This is actually quite representative of what every individual should do to have a good mental health. Okay, for public health training. So I know this is a bit technical, but I think it is important for us to have everyone be aware of what are the scope of public health, which is very wide. So it includes a lot of other issues. So it should be part of public medical doctors training as well, even medical students for that matter, so that it is to improve healthcare, not just the medical care of patients, but the total health of that patient. So all these are very important, and I hope that it will be brought up in the near future because of the pandemic. It shows that public health has a very important role to play in the healthcare system. Moving on to digital health, I think this will be something that all the Gen Y, Gen Zs, and the millennials are very familiar with. So COVID-19 actually brought out a lot of new technologies that we are using currently in terms of wearables, diagnostics, because now we have saliva test kits for COVID-19, which was not available during the early phases of the pandemic. And we have smartphone apps for contact tracing. And we also have targeted messaging through social media for health information to the public as well. So I'll just share with you what we have in Malaysia that that involves digital health. So previously, for COVID patients, assessment has to be done in person, and because the government had to pivot because it is a very high risk for so many people to actually gather in one location. So we started the virtual COVID-19 assessment where doctors and healthcare workers actually assess patients online virtually so that patients do not actually have to travel to these centers to be assessed. And we also have quarantine manual orders which involves a wristband as well as a formal and legal quarantine document. So this also requires the patient to actually travel to centers to get this physically. So to reduce the burden on healthcare workers as well as the risk of infection, we actually started using digital quarantine order, which is through an app that we have in Malaysia. So patients do not actually need to go out to get all these documents, and it is just easily accessible via an app on your mobile phone. Okay, these are the digital tools that are available currently, and it will actually improve with time. So in terms of your wearables, your Fitbit, in terms of how to diagnose patients, how to treat patients. So recently with the 5G rollout, people are talking about remote surgery, which was done only in developed country previously. So with 5G, we can do much more. And it will be an interesting period post-COVID to see what other developments for digital health in this sector. Okay, talking about inequality is something that I'm very passionate about, because there is something that we need to focus on, because healthcare is a right for every individual and everyone should have access to healthcare. So this is a map of Brazil. So if you see in this map, it will show you what are the disparities causing the effect of these disparities on COVID-19 actually. So if you look here, so the red ones are the more vulnerable population or the communities, and the blue ones are less vulnerable. So if you can see here, so here, the population at risk are actually in these locations. Oh, sorry, I actually switched it, my bad. Okay, sorry. So the red ones are actually the less vulnerable. So if you see here, the number of ICU beds are more in the affluent areas. So, and you see those who actually die from COVID-19 are those in the poorer regions. So it does shows when you have poverty, when you have low socioeconomic status, you are more at risk of dying from COVID-19, because the services available for healthcare is all usually concentrated in areas that are more affluent and with higher socioeconomic status. So if you see here, there is a disparity, and with public health, usually we will focus on these disparities because these are the social determinants of health that is very important for us, because health is not just limited to the treatment, but it has a lot of other effects as well from other sectors as well as other determinants. And the next thing I would like to talk about is vaccination. So everyone was talking about the vaccine inequality. So if you see in this map here, so green ones are the countries that have at least one dose of vaccines. So and the orange and brown ones are those that are not getting even a single dose of vaccine. So you can see that the disparity in this globe, that a lot of the poor, lower income countries do not have access to vaccines. And for example, in Malaysia, we have access to vaccines. Our vaccination rate is about 78, 79%, similar to Japan as well. So Indonesia is at about, if I'm not mistaken, 40 to 50%. So, so these are the problems faced globally, because vaccination is important, and it is not just for yourself, but it is for everyone, because the pandemic doesn't stop when the whole country is vaccinated. The whole world needs to be vaccinated. So that is one of the disparities that we are facing right now. So with the booster rollout as well, so it actually reduces the chances of these poorer countries from getting access to vaccines to get even that one single dose. Okay, if you could see here in this graph, it shows that the number of vaccines that have been purchased by higher income countries, upper middle income country, it actually takes up about 54. The 54% is actually from the higher middle income country, meaning that they have actually 2 to 3 times what they actually require. So it's actually called vaccine hogging. So the upper middle income country, which Malaysia and Indonesia are, so with 37% of us, we only are getting 18%. So a lot of them are not actually receiving it. And the lower income countries has 37% population requiring vaccine, but only 12% of them will have it because that's the only amount that they have purchased. So I would like to talk about COVAX. It's a movement from WHO, Gavi, to actually purchase vaccine to vaccinate 20% of the population. So good news is that recently they have actually been able to purchase 1 billion vaccine and has actually administered that recently, I think. So which is a good thing. So because they focus on lower income countries more and the lower middle income countries as well. Okay, this is talking about health equity. So like I mentioned earlier, usually people just focus on this section, the disease, the injury, the mortality. But for health to be productive, for someone to be healthy, it actually involves a lot of other things as well, which involves risk behaviors, your living conditions, your social environment, your inequalities in terms of your access to education, access to healthcare, your social inequalities, your race, your ethnicity, because we've been hearing a lot of it, how ethnicity affects your health. Because a lot of studies have been done in the UK, in the US, that shows that minorities, Black, African American, actually have poorer health because of their ethnicity, because of a lot of social determinants that affect it and actually causes the poor health. So we need to look into policy to actually change this. So hoping for the future, governments, civil society, university should look at issues of social issues, environmental issues, the economic issues that affect individuals, because indirectly it actually affects health. So these policies has to come hand in hand for us to be healthy and productive. I would like to talk about the universal health coverage, which is also called the universal healthcare, which provides access to free healthcare or affordable healthcare to everyone, regardless of gender, regardless of sexuality, regardless of nationality. So with the full access to quality healthcare, which is accessible, affordable, it actually improves a lot of stuff. It actually improves the education, your poverty, gender equality, as well as your health literacy. I would like to talk about the SDG later on as my closing. So for me, the basic thing is to have access to healthcare. That's the most basic. And having access to healthcare actually improves a lot of social factors, a lot of other dimensions of the population or the community itself. And I would like to talk about partnership as well, because the public and private partnership is very important, because the government cannot do it on their own, as shown by COVID-19. It needs other stakeholders to help to actually reduce the burden on the healthcare system that is so strained as it is right now. So I would like to give you some examples of the public and private partnership that has occurred in Malaysia. With vaccination, for example. So we roll out the vaccination very fast within a few months. And to actually sustain that momentum, we actually engage with private practitioners, private hospitals to actually administer vaccines at vaccination centers that are not public owned. So that has reduce the burden on the healthcare workers that are in the public sector, because they have other day jobs, which includes their current jobs of treating patients, of vaccinations that are non-COVID related. So that actually alleviates some of the burden on the public health system. Talking about treatment on COVID-19. So initially it was fully financed, run by government. So with the initiative with the private partnership, private clinics started to come in to provide services to treat COVID-19 patients and to have assessment done by hospitals at private facilities that does not interfere with the public facilities that we have currently. So it doesn't crowd that facility, which is a good thing. And for research, we've been doing a lot of research on the vaccination because we need a lot of data. And with COVID-19, research has been coming out, churning very fast. So with the vaccination research that is going on, a lot of private facilities have took up the responsibility to actually partner with the government to actually run those research, because with local data, we can actually use those data to actually advise and to influence communities to take up the vaccine, because vaccine saves lives. And with social media, with misinformation, I think local studies actually will provide a boost and a push for the government to actually convince the community to take up the vaccines. But what I would like to share is this. Instead of just the public and private partnership, I would like to borrow this proposal of a public-private people partnership that involves people in this partnership, because at the end of the day, it's the people that will actually get the service of what the public-private partnership would provide. So if we actually involve them as a stakeholder, we would know what their needs are. And for when I say people, usually it's not just everyone that you need to get involved with. You can actually just engage with civil societies, NGOs, community leaders, universities. These are the people that will know what is best for the community and what is needed, instead of just doing a public and private partnership and just providing services thinking that the people are homogenous. But in actual reality, people are very heterogeneous. They are very multifaceted and they are multiracial. So there are a lot of needs that needs to be met. And I think this partnership will be the future if we actually have more public engagement and to actually improve on our public-private people partnership. Okay, this is my last slide. So as mentioned earlier, I would like to talk about a bit on the SDG, because something that is very important and something that has not been in the know, especially in Malaysia. I'm not very familiar with Singapore or Japan, because for me, SDG is very holistic in how we actually treat the globe and the people and the environment, the inhabitants itself. So I saw in the poster that there were 2 SDGs, which is I think it's the 4th SDG, which is the quality education, as well as the 11th one, which is sustainable city and communities. So I'm very involved with SDG because health is very central to the SDG. So it involves all aspects of the SDG. So if you don't already know, so the SDG, there was 17 of the goals. So 169 targets and 232 indicators, if I'm not mistaken. So it is because we are talking about partnership earlier. So partnership is the 17th goal. So actually all these are interrelated, and actually we can actually do much more and achieve small milestones in our sustainable development in terms of education, in terms of healthcare, in terms of our consumables that can be less damaging to our environment as well as our climate. So I hope that you will take some time and reflect on this, and hopefully it will give you some ideas of what the future will bring in terms of post-COVID, specifically for healthcare, which I shared today. With that, I thank you so much. So, okay, if you would like to contact me, you can actually add me on Facebook, Instagram, or LinkedIn. So you can actually find me with Peter Gan. Yeah, that's all for me. Thank you so much. Thank you.
Thank you very much, Dr. Peter. And I was actually, my background is architect, and I'm really understand first definition that you say that not many people understand what is the public health, and I realize that I don't know exactly before, and you say that is non-hospital based health. This is really interesting because you have to improve the healthcare, keep public community health, but I learned from your presentation is you have a wider target comparing with the hospital-based one, limited resources, but with complicated problems. Was it true?
Yes, it is. I think that it's the issue that every sector faces, I think, with limited resources. How do we pivot? I think with the new generation, it is actually very hopeful that they will be able to come up with solutions, innovative solutions to fix that problem. Because I think what we have been practicing has been repeated many times, but we're hoping for a different result. So I hope that the new generation will be more what do you call that? Semangat, which is they are
yes.
To actually take up that role to change our current system and to be more sustainable, because climate action is something that a lot of the youth are actually very passionate about, and I hope that they will actually be passionate about it because it is their future.
So then you have two keywords for young people. One is a digitalize of the health problems, and the other one is partnership, because you have to believe that partnership will be increase the resources, right? Thank you very much. So then I will invite audience to ask a very interesting, really understandable presentation. So let me check the okay, is there any raise hand here? Usually Bu Faizatul from Malaysia also, or Kawawaki Sensei, or students. Okay, I'll wait for others to raise question. But one thing that I wonder, I have a discussion while Zooming with other friends in other countries. Argentina, for example, European countries, some other countries, even my Indonesian community also has the same problem. There's still people don't believe in COVID-19. And the problem is that they don't want to have vaccines. So this is community problem, right? It's not only poor people, but also educated people don't want to be vaccinated. So are you facing the same problem when you meeting the community somewhere in the Mercies or in Malaysia or wherever? So people don't believe in COVID and don't want to be vaccinated.
Yeah, Actually, it's a problem everywhere, not just
Yes.
yeah. So, but for us, I think what we need to do is be more transparent in our information sharing with the public. So there are a few groups of people. So they are anti-vaxxers that will, even with the list of information that you provide, the list of evidence that is hard evidence that shows that COVID-19 is real, even the vaccine is safe and the vaccine is effective against COVID-19, they will still not take it. But then you will have those vaccine hesitancy individuals that are on the fence. So with proper information sharing, because I think what we are lacking is how we are not as strong in our advocacy of sharing information. So you need to drown those misinformation with proper information. So that, I think that is one of the ways that we need to look at it. So it's is aware of it. So you can't just say it once. So because behavior change is very difficult and it takes a long time. So you need to be more regular. You need to talk in ad nauseum to make sure that people understand with the new data that is coming out, which is a lot of data. And a lot of them are actually hard evidence that has proven that the vaccine is actually very effective, even with Omicron as well. So that's why they are rolling out the booster. So hopefully with that information, more people will take up the vaccine. And also if the vaccine is available for that matter, because a lot of people, especially in the sub-Saharan Africa, do not have access to vaccine. It's not that they don't want it. So, but for people who have it, who have access to it, I hope that they will go take it.
Thank you, Peter. And I will ask a student from Japan. You can ask with Japanese. 質問できますよ。学生、クイズからの学生、もし質問あればどうぞ。I will ask also then when Professor Jamanik presentation from Malaysia also to ask. So なんか日本からの学生が質問がありますか？
皆さんどうですか？日本語 OK というカプタラ先生の話ありますよ。
いや、
もちろん、英語でも大丈夫です。
雪正さん
まさきくん、いかがですかというご指名。英語で言うのも大丈夫。
どうぞ。
Okay. ちょっと止めますね。すみません。どうぞ。I want to see PowerPoint slide again.
You want to Dr. Peter to show your PPT?
Yeah. Yes.
Okay. Sorry. Can you just showing again your PPT and Yuki Masaki-san want to maybe asking some of the pages of your presentation?
Sure. No problem. Okay.
Okay, which part, Yuki?
It's end of the.
Oh, end. Okay.
Yeah. SDGs.
Okay.
Yeah.
SDGs. Okay.
Yeah. I want to know the how Malaysian to solve the problem about the SDGs. How Indonesian government I want to know the Indonesian government policy to solve the SDGs.
Okay. Okay. Yeah, got it. So maybe Dr. Peter can also answer on Malaysian first. If you know the Indonesian, then you can elaborate on that. But I think maybe Malaysian the SDGs first.
Yeah,
Please.
thank you. Yeah. As for Malaysia, we do have a planning unit that actually deals with the SDGs specifically. So because all these are indicators, so they are measurable actions that has to be taken for you to achieve it. So data collection is very important. So one of the things is having data. So a lot of these things are not available previously because we are not in a highly developed country or high income country where all these are already in place. So first of all, we need to build that system. And so far, the only SDG 3 is the only one that can actually show the difference in terms of our improvement, because in healthcare, we actually collect a lot of data, but then you will have very limited data on consumption, on land, all these things, because these data is not available. So what I suggest personally is to actually achieve mini milestones as compared to what the SDG is asking, because small achievements when summed up actually makes a lot of difference. So that is one of the things that I would like to reiterate, and I hope that the new generation will actually take up this task, because we have about 8 more years before the SDG ends in 2030. So we have 8 years to actually do something about it. So small steps, those are the things that will actually make a difference. But in terms of the government policy and stuff like that, there isn't such a rule. But a lot of individuals, corporates, university, for example, are actually using this as a way to change mindsets for the future generation, because it's very hard to change the mindset of the older generation. So hopefully the newer generation will take up this challenge. Although this problem is brought to the newer generation from our generation, but hopefully they will be able to solve this problem.
Yes, thank you, Dr. Peter and Yuki-san. With one question, Mas Wahyu. Hopefully, you can ask simple and short, please.
Yes. And thank you, Pak Ika Putra, for the Dr. Peter for the presentation. And I want to ask one question, or maybe two, but it's just a question. As you mentioned that, excuse me, my voice is clearing.
Yes, yes.
Okay, but I'm sorry that I can turn on my video because the unstable connection. So the first question is, as you mentioned that the Malaysian is maybe many of the citizens have vaccinated the first doses, and how's the situation in Malaysia that affected because of this vaccinated, especially for the tourism? Is tourism going to normal or etc.? And the second question is, as you mentioned that the digital quarantine application. My question is that the application is just for the Malaysian citizen, or maybe for foreign citizen that maybe have a holiday in Malaysia or work in Malaysia. Maybe that's all from my question. Thank you.
Yeah, thank you so much. Yeah, regarding tourism, actually Langkawi is a travel bubble currently. It's an island in the north of Malaysia. So it's similar to those travel bubbles that you go to, like for example, Phuket. So there are tourists that actually go to Langkawi. So for you to be able to travel there, you need to be fully vaccinated. You need to take a test before you fly in. So you need to prove that you have vaccination. So there is this app called MySejahtera that you actually non-Malaysian can actually register for it, and then because it detects close contact. So if you're using because it uses this Bluetooth technology where it can actually detect your proximity with the confirmed case. So let's say if someone is infected and you have been in close contact and your phone actually register that. So the phone will actually notify you that you are a close contact, that then you need to take precaution. So that is one of the things that we are empowering public to actually do, because initially we are doing it very manually, where we have to call individuals to make sure that they have their close contact list. So with this technology, which is very easy and it doesn't take a lot of manpower, so the app itself will tell you that you are a close contact, and then you will be required to do your precaution, which is to go into quarantine. So your second question, I'm sorry, I've kind of lost track. What was your second question?
About the application of the digital quarantine, just for the Malaysian citizen, or foreign.
You can actually download it. It's called MySejahtera. It's actually a application that is developed by the Ministry of Health. So I'm sure like every country have their own application, because with smartphone and with new technology, I think application is very common these days with everyone. So I think it's just that the function varies. So for us, our application actually provides the proximity information as well as your vaccine status in it. So it shows so that you don't have to be bringing your card manually. So that is one of the things that we have been improving. If you see the development of the app, when it first started, it was very old school, and till now we just had the Bluetooth setting actually just developed recently. So just last month it was rolled out. So with that Bluetooth technology, we can actually use to track close contacts, and those who are actually, because it is a target where you set close contact as they are within 1 meter after 15 minutes, then you're a close contact. So that is the thing with this technology. We are able to detect close contact without actually using more resources in terms of manpower to actually trace all these close contact. Yeah. So in short, you can actually, foreigners can actually download that app.
Thank you very much, Dr. Peter, and I apologize to extend your time because I want to have more communications on this Zoom meeting, but we still have one expert. Thank you very much, Dr. Peters.
Thank you.
And the next expert is Professor Chanianton Damanik, my friends. And Professor Damanik actually earned his bachelor from Gajah Mada and also master program also from Gajah Mada University, but he graduated from Universität Bielefeld, Germany in 1919. And what is special for Professor Damanik is he has already involved in tourism since especially 2010 and 2012 till today, either become secretary of Center for Tourism Studies in UGM and also as a chairman twice. So I hope that this is a good insight, because Professor Damanik will give a lecture on COVID-19 impact on the global tourism. His next first time is yours, and hopefully it's because the last 20 minutes Pak Damanik, mohon maaf ini tadi dipersingkat. Monggo, Pak.
Thank you, Pak Prof. Ika. Distinguished ladies and gentlemen, I would like to present the case on of Indonesia in terms of the COVID-19 impacts on tourism. As Prof. Sorry. Sorry, I can remember that. Nakamura Sensei, yeah, has mentioned before that tourism is a very fragile economic sector that heavily get impact from COVID-19. So I think all nations have the same problems by dealing with COVID-19. So sorry, I have to, maybe it is the repetition of the presentation before, or the previous presentation from Nakamura. So the global impacts of tourism can be seen in how the GDP, the global GDP, have changed or fell into from 10.4% in 2019 to 5.5% in 2020. So we know
Professor Damanik, would you please do a slideshow on your PPT?
Pardon?
To share with
slideshow. Oh, sorry.
No, slideshow.
Okay. Yes.
Yes.
Yeah. Can you see that? Yeah. Okay. Yes.
Yes.
So as we know, that tourism depends on many factors, and one of the most influential factors, the health condition. In this context, pandemic, COVID-19 pandemics, let's say that this play an important role to tackle the tourism development in all regions. Related to the health issues, for example, pandemic can be seen as a new enemy of modern tourism. I think it is not only COVID-19, but also the previous pandemic, some pandemics in other parts of the world, as it hits the travel industry hard and directly and unexpected. We can do any projection, any preparation for the pandemic, because it comes so unexpected. So this is the another description of the impacts of the COVID-19 on the global tourism. We see this has been many times published in the international publication, but what is the interesting one is that in Pacific, Asia Pacific region, we can see that Asia and Pacific region is affected by COVID-19, the very strong and make the tourism economy here has been felt unto minus 53.7%. This is the global picture of this impact, and as WTTC 21 claimed that in 2020 was the worst performance of Asia Pacific regions. Tourism contribution to GDP dropped by 53.7%, ranging from 36.5% in South Asia to 56.4% in Northeast Asia, and the highest is Central Asia with 57.6%. International spending fell by 74% due to border lockdowns. And in Asia itself, domestic spending declined at 48.1%. We see that how it's distributed in Asian countries. Indonesia, this negative growth was 35.2, etc. And the highest one is that in Singapore, because we know that Singapore is the best destination in Southeast Asia. And employment rate fell by 18.4%. It is equated to 34.1 million jobs. This is the lost jobs during this first time of pandemic. What is the implication of this pandemic on global tourism? As the presenter mentioned before, there's a restriction on the movement of the cross-border tourists. This is the very, very important factors that why the global tourism or regional tourism also have to stop. And the second one is the priority on domestic market, because domestic markets are still there, and it's easier to manage as the international visitors. And of course, the priority on safety and security. Yeah. So I would like to present a little bit data on coronavirus in Indonesia until the last year, January 15th. Yeah, we have cases 4.2 million, and that is 145,000, and recovery for 0.1 million. So it is the trends of the number of the cases in Indonesia. And I just listen from or read from the social media now that in Jakarta, for example, has reached over 10,000 new cases today. Until now, yeah, and per day is until more than 1,000 cases. It is the new cases for the Omicron in Indonesia, particularly in Jakarta. So how does Indonesia respond to the global tourists during the COVID pandemic? The first one is that, like in Japan, I think that implemented the mobility restrictions, including lockdowns in various regions. So in Indonesia, yeah, I think you have the big picture of Indonesia. It is very, very big. Nation is from east to west, or from west to east. So we have a very different regulation in local as well as in national. From the national regulation, the government has set an policy to lock down every state or every regions. But in the regions itself, there was a difference policy taken by the local governments. Establishment of COVID task force, we have BNN. It means a special task force for COVID, which includes dozens of ministers and also the private sectors. Government reallocated state budgets and give the priority to prevent or to cure the effect of the COVID-19. And we know that because we have a very big nation, I think that handling difference stands out between village and city, because the COVID-19 cases were most happen in the urban area compared with the villages, some village or rural area. The urge to increase public participation by campaigning for law number 24/2007, where this law stated that disaster management is shared responsibility of the government, not only for the government, but also of the society. So it means that the government approach all social and cultural groups to take the responsibility to handling the impact of this pandemic. Indonesia have made free mass vaccinations in states. First of all, of course, medical personnel, state civil servants, and because they have a very close contact with the others in terms of the social services or servant as government servants. But in December 2021, the vaccination has reached up to 43% of the total population. As mentioned before, that Indonesia is a little bit late compared with the other country like Malaysia or Japan. Health service, we propose GNOS. GNOS is something like prevention measures and tools produced by our university, Gajah Mada University, and has been retracted by the government for other reasons, and SWAB and also PCR. And gradual restriction of crowd activity, we prevent the activity, for example, in the mosque, a church, or also in supermarket, mall, etc. And also, for example, football has been banned by the government because it can be serves as media for the pandemic spread. Increased acceptance of vaccination, as mentioned before, that Indonesia is not the only country where the people have the resistance to be vaccinated. Some of social groups or local people opposed to practice their vaccination because they have a very different mind, different culture, different understanding about this vaccination. Compliance with protocol improves, especially in economic activities. Indonesia tried to improve all the protocols and also to set the new tools to higher the effectiveness of the social distancing, and also the using of masks, etc. Governments have set policy for handling the impacts of the pandemic. For example, the government has built the special settlement or exclusive settlement for the COVID victims. For example, in Jakarta, we have a very big resort or hotels, and it has been changed to be the station for the pandemic COVID. And also in the some regions, particularly in island of Java, there are so many special shelter for people who are infected by pandemic 19. I would like to describe more specifically the macro response of the Indonesian governments by setting a tourism policy in terms of tourist management, host handling management, business management, and product chains, and special policy and regulation. This is a little bit information about international visitor arrival in Indonesia in 2021. As we know that before COVID-19, this is June, July, and August is the very we know that these months are the peak seasons for the internationals as well as domestic tourists in Indonesia. But during pandemic, particularly in 2021, we see that this is very low. What is the tourist management set up by the government? How did the government and private sector efforts respond to the needs of tourist market? It means that the government has issued various policies to limit the mobility of people to suppress the spread of COVID-19. I can mention just the government policy, because besides on the government policy, it's really that there are so many community action and group action to suppress this spread of COVID. But sorry, I think we can discuss about this issue in other meetings. And ban on international visitors to Indonesia in January 21, but it's just for 2 weeks, and after that it's reopened for the international visitor from some of countries from Asia and Australia. And PCR obligation is an obligation for the domestic tourists traveling abroad. Foreigners holding visas and temporary residence permits can enter Indonesia, but only through certain immigration checkpoint. For example, Jakarta or Bali or Batam in 3 points, I think. It was taken by the government, and in almost all destinations, visitors restrictions are taken by the local management to prevent the spread of COVID. And next, handling tourism business and change. It mentions how action taken to protect tourism business. The governments launched the national economic recovery programs, where tourism sectors got a tax incentive of 3.8 trillion. Sorry, I forget to convert it into US dollar. So yeah, let's say it's yeah. Sorry, I can count it into US dollar. Government incentive assistance through a Ministry of Tourism for emergency response for tourism and creative economy workers. So we, Indonesia, offer this emergency fund, but in very limited number compared with the number of, let's say, micro or medium or small scale economic units, economic industry, and training or upskilling tourism worker, because there were so many tourism workers from hotel, from travel, business, travels bureau, and other tourism sectors that has been stopped by the management, and they have to be sent to another sector by upskilling. And then tourism health protocol application is a must in all segment of the communities. Management of host communities is actions taken to protect the wider community by setting the presidential decree number 21 in 2020 on large-scale social restriction. Yeah. Even though that not all people like this presidential decree, some of the strong community interest groups had tried to deny this decree and decree of Minister of Transportation on transport control, including jury rights, where the mobility of the domestic mobility were very high. And a health protocol has been launched by the Minister of Health and Ministry of Tourism. And as I mentioned before, there were also government financial support for MSME, micro, small, and medium enterprises. In policy and regulation, gradually loosen travel restriction while continuing to tighten CHSE practices, and more reliable health protocol. And Indonesia try to increase the trust of potential tourists by stimulating new demand for safe and clean labels. For example, the Ministry of Tourism has promoted the 3 main tourism destination in Indonesia: Bali, Batam, and also Jakarta, just to stimulate the international market to be aware that Indonesia is better than before. But because pandemic, COVID-19 until at the end of 2021 is not better. So government try to renew their promotions, not to promote Indonesian destination to international market, but promoting a domestic market. I would like to inform a little bit about what is the very significant policy and program actions by the Indonesian governments. We know that we have a Peduli Lindungi. Yeah, it means that care and protect, where everyone who wanna be travel, wanna be involved with the travel group must have this certificate, yeah, this Peduli Lindungi, care and protect. It means that everyone must be vaccinated, at least the first vaccination, yeah? And if he or she will travel abroad, he or she has to be vaccinated in the second phase. This is very important for people in Indonesia who want to be mobile, yeah? By using the transportation modes and crossing the border of a province or region. Yeah. And what is the targeting markets? Yeah, targeting domestic markets. We know that even though that the pandemic or war or whatever that disturbs the economic activities, the need for recreation itself never stops. Yeah? As really people really needs relaxation. Therefore, that's why we know that in Indonesia there are until now 275 million domestic trips. Yeah, this is the data introduced by Indonesian Statistical Bureau in 2019. It means that 275 million people are the potential market until now. But we face with the specific challenges, including limited operation of airlines and hotels due to containment measures and due to inconsistent measure, because the impact of COVID-19 itself is different between amongst regions in Indonesia. So the local government has the authority to open or to close their regions. and depend on this local policy. The operation of airlines is also impacted, and also hotels. Yeah. If the local government say you have to close your hotel, they have to be obeyed. Low interest to domestic destination. Indonesian, particularly the high economic class, they have a little bit low interest to domestic destination. They wanted to travel to Japan, at least Singapore or Malaysia. Low demand due to fear of infections in local destination. Local lockdown uncertainty, this I have mentioned before, and decreasing purchasing power. So this is the challenge why this market really cannot be easier to reach. Reactivating and revitalizing tourism products and destination innovatively.
Professor Damanik, could you just make briefly?
Pardon?
Yeah, could you just finish soon? Because
yes, I wanna finish this maybe next 2 slides. Can I?
Yes.
Okay. So primary tourism destination as a prime mover, because the infrastructure and facilities are the most complete. Special interest-based local attraction are continuing, despite their limited operating time. So not daily, maybe twice a week, 3 times a week, etc. Strengthening the government rules, and by continuing to support incentives, particularly for special areas of tourism. We know we have 5 priority destination in Indonesia, and this is promoted by the central government from North Sumatra, Central Java, Lombok Island, and also Flores Island, Labuan Bajo, etc. Tightens the implementation of GHAs, monitors and the public compliance with the health protocols. So, and this is the very important factor to be noted as factor for succeed the tourism recovery. Accelerating the vaccination programs. Vaccine is the first passport for everyone. Without vaccinations, it is possible for anyone to go to visit the destinations. Therefore, the programs should increase the number of people getting vaccinated, expand the range of vaccination program, build more confidence for people to more frequently travel, including also educated people to accept the benefits of the vaccination programs. This is, I think, this is the specific problems for us, because governments, have a very different perspective also. Local government particularly have a very different perspective on this resistances of the local population. Now I go to the closing remarks that tourism remains an opportunity for Indonesia in the future, because it actually not only contribute to economic development, but I mean that Indonesia is well known at least as a secondary tourism destination in Southeast Asia, and we have a big captive market in ASEAN region that Indonesia can catch this market to be to invite Indonesia. Tourism recovery depends on progress in eradicating the global COVID. Indonesia is playing an important role by increasing the achievement of vaccination target for the entire population. But important is that a supportive social ecosystems to be built, including the consistency of government policies in handling the impact of the pandemic. Also, public acceptance of vaccinations and strategic alliance, coalitions, and partnership of stakeholders that has been mentioned before. I think this is my last presentation, my last slide. Thank you for your kind attention. Please raise question if any. I would like to give my response. Thank you very much.
Terima kasih Pak Prof. Damani, and I think it's good because we have a global effect on pandemic, but it's many example of the local strategy of policy developed in Indonesia, and it's become the share for the world. Because I'm so sorry to have around 20 minutes late, but I'm still want to have one question from the floor, if any. Okay, if there is no questions, I think I have to give the time to Pipit. Is there any event? I mean, a closing from Pak Andi or just But before that one, we have to give applause to Prof. Damani, who has become a last speaker and become last sharing from the 3 sessions of the online workshop or school between quiz, other university like and Jogja and UKM, and I think it's continued from the last 5 years. Bu Pipit, times I give back to you. Thank you very much, and
Thank you very much, Dr. Ika Putra. We reached to the end of all of the session from the workshop of ACP. So for this session, I think to close, we can hear from the ACP board in regards to the final presentation that will be held on 1st of March, if I'm not mistaken. So maybe Kawawaki Sensei, do you want to tell anything? Thank you very much.
Yes, thank you very much. Thank you, Ika Putra Sensei. Interesting session. Good coordination and 3 excellent speakers. We are very much interested in the topics. And so as Pipito-san made the announcement, we will meet much fast, and we will have a symposium. We hope students will make maybe 15 or 20 minutes presentation, and maybe 2 teams from one country, one university, and the total 8 teams will make presentation. And so a lot of comments from experts. So we hope we can meet again. And thank you very much. Very interesting today's session. Thank you. See you again.
Bye. Arigatou gozaimasu. Thank you very much. Terima kasih.
Thank you very much.
Thank you, Pak Ika
Terima
Putra.
kasih.
Terima kasih Pak Gamane.
Thank you,
Terima kasih
everybody.
Arigato Kamora Sensei,
Thank
Thank you so
Dr.
much.
Peter, and everybody.
Kasih.
So again, take photo. What do you think? Or Kaidin Sensei, Kaizatsuru Sensei. もう出ちゃいました。あ、Okay, so thank you very much. So we'll see on March 1st. Thank you very much. See you.
Record.